Okay, hi, good afternoon. I'm Wen Chang. I'm an orthopedic surgeon in Westchester. I'm with Sarah.
Yeah, and I'm a physical therapist.
That's right. So tell us a little bit about who you are, what is your experience being with exercise and sports events.
So I work for an outpatient physical therapy at a hospital, and basically what we focus a lot on at our place is just general exercising for all types of injuries, all types of surgeries, whether it's like hip replacement, shoulder surgery, rotator cuff repair, all that stuff. We also do a lot, I'm not sure if you've heard of this, but it's called PRI, it's
Right.
Restoration Institute, so we do a lot of training techniques for that. And working on posture, working on everything.
Well, cool, yeah.
Yep.
My particular device of which I invented is called the ShoulderSphere.
Okay.
And it's a specific training program for the rotator cuff.
Okay.
And the exercise, as we know today, in terms of the rehabilitation of the shoulder, your arm, come in the linearly directed.
Yeah.
4 basic moves. Either the push, the pull, the lift, or the press.
Yeah.
And except for 2 exceptions. The vibratory tool that the body plays,
Yeah,
which
yeah.
they're very familiar with.
We
And
use
then
that.
the back and forth is a vibratory linearly driven activity. Or the ergometer, where the shoulder exercise, or the bicycle, where they grind it through, so that's a circular pace.
Yeah.
But when we realize that the movement of the arm is more of a spherical, it's directing the position of the hand in space, in a spherical motion. And as I consider that the ancient Chinese martial art or exercise technique of Tai Chi, in front of Tai Chi.
Yes, absolutely.
Tai Chi, really the words in Chinese derive from the meaning of polar opposites and the opposing forces or the yin yang and ever changing. So the technique being that you envision the movement of Tai Chi as a movement of sphere in your hands. So that's why you see the exercise always moving. And thus gave in the birth of my device called the ShoulderSphere. So what it is, this is a demonstration. It is 7-ounce bearing within a spherical ball here. The most important component of the usage of this technique is to lock your wrist in. Because when you lock your wrist in, you obviate the movement of the wrist. You spin the sphere. The only way for the ball to move is by movement of the rotator cuff. Because the elbow only goes up and down. If the elbow goes up and down, the ball bounces. So in order to make the sphere spin, you generate all the forces from rotator cuff. And I've actually subjected myself to EMG studies. This is 200% more effective and more efficient than your standard workout. How do I say it's 200%? Because the needle EMG states that at the most rapid pace that I can spin the ball. Right now, as I'm spinning the ball, it's about 360 times per minute. That translates to 6 hertz by muscular contraction. I can only top out at about 6 contractions of my rotator cuff per second. While using the very good device, the body blade, it's excellent in terms of a lot of the therapists use that. When you move this, I can top out at about 12 up to 14 hertz. So what that means is that I'm actually using accessory power to move the shoulder, as opposed to this isolated rotator cuff. You know, 2 times more efficient traction. So it gives you more difficult workout. The other benefit of doing this is only 7 ounces. You're using your own potential energy to translate into kinetic energy to move the ball. The greater the velocity of the spin, the greater the intensity of workout of the shoulder, as opposed to standard weight. With weightlifting, you are driving in the externally directed source. So something gives. Either the weight moves, or if the weight doesn't move, the shoulder moves. So it may be prone to injury. So with this, you are generating your own internal energy directly into the external, into the movement of the sphere. Alright, so you're the first one to give it a try.
Great.
Alright. Since you're a rock climber right here, so you're riding?
Yes.
You're riding, okay. Okay, so you're riding, right?
Yeah.
Okay, so might as well give you advanced model.
Okay.
So what you do is that you just cradle this gently so that you wrist is nice and relaxed. Nice and relaxed. And with the strap, you snug it on like this. Strap it on.
So how many of these have you made so far?
I've made a couple. Yeah, a couple of these. Alright, so now your skin is alright?
Yep.
Okay, make the ball spin. It's very simple.
And I can feel everything just engage, like especially my shoulder, the whole shoulder girdle around. I'm gonna keep doing it until I start to feel. Should I keep my hand relaxed or?
Keep your hand totally relaxed because you are one. The shoulder, you're translating the shoulder movement, the rotator cuff to this energy over here.
Yeah.
So everything you are one with the shoulder. And then the beauty of this exercise is that you simulate event-specific exercise. For instance, if you want to go rock climbing,
Yeah.
you simulate the moves as if you go to the rock climbing. So as you spin it, so you generate a linearly driven force into the spherical force. So the vector force actually makes it tremendously difficult. So if you want to make a lateral move, you move out to the side here and keep it spinning.
And obviously I'm not doing as good as you.
Keep it spinning hard.
Yep.
And if you hear it bouncing, like we said, you're losing the control of the rotator cuff, using your accessory power boost.
You do want to pressurize the ball a little. Just a little.
Yeah, I'm trying. I'm like keeping my hand totally relaxed.
Right. And then you can see that you can't, you don't even have to grab onto the hand. Just palm it.
Wow.
There we go. Oops, lost it. Getting a little easier.
So you can do cross shoulder diagonal moves as if you're trying to make a move onto the side. And you pull down. And you do all the rotator cuff exercises, like being out diagonal. And you can do your push pull. You can do your push pull front and back.
And I can feel it burning. I really can.
It's a much more specific part of your rotator cuff. More so than the standard rubber band exercise or the weights exercise. And then so you can do internal external range of motion as you spin.
And then would you recommend reversing the spin as well?
You don't have to, doesn't matter. As long as it's spin setting, you're engaging your rotator cuff. What it does is it's a multi-directional synergistic arena. It's a rapid burst of a proprioceptive exercise, much more effective than the slow weightlifting of one direction. This is multi-directional. So you're educating the rotator cuff and then the tendons muscles have rapid fire in opposing sides. So that's sort of like the Tai Chi. You're ever changing. You're ever changing at the polar opposites. Your opposing moves are enhancing each other's behavior pattern. As you change the direction, you're educating the movements of the shoulder. Because our daily activity involves the spherical movements of the arm throughout three-dimensional space. It's not deliberately driven.
Exactly, it's not. And that's,
And then if you're a bowler, you can go down and go up. And you can incorporate this into like a Tai Chi. Go up, make a circle. And you can make it straight. And so you can do it all directions, all the exercises.
it's like the body works together. It's not just segmental.
Exactly.
Tired yet?
What's that?
You tired?
Yeah, no, it's burning.
Yeah.
How does this differ from any of the other exercises?
Oh, it differs a lot. I like how it actually rates it all of the rotator cuff, like you're saying. It's not just one specific linear thing. You can really feel it working, and it's engaging just the right muscles and making everything work together, like you're saying, the way that it should. It's not just like a simple movement. What is that doing functional for your hips? It's not a really functional exercise, and that's what now as a PT we're trying to get everyone to be more functional with normal daily activities, getting those muscles to work the way that they really should.
Exactly. It's a functional exercise. So the program is that you can stay in one position, do a static workout, keep it spinning, in one position, another position from your body. And each position alters the behavior pattern of the rotator cuff. It's a different part of the muscle. You can do it in the front of your body. It's another position. You can feel the different parts of the shoulder engaging. And then you can do it up here, figure out 4 positions. and you can translate the movement side to side.
Yeah.
And as a famous movie Karate Kid, wax on, wax on.
Yeah.
And you can make a big circle, make a big circle, and then the opposite circle go to the opposite direction.
A little better, a little easier.
Diagonal movements.
And that's what a lot of the exercises nowadays are. We're trying, obviously, to relate it to function, but we're trying to, like I say, incorporate the whole body and incorporate your posture into it too. And I can see how this would help
Exactly.
that. And it's, again, it's not just that linear movement, it's everything. So
Right. And you're not tied down to the machine.
Right.
Not tied down to the round machine.
Exactly.
And not tied down to the weight. And it's affordable,
Yeah.
safe, effective, and efficient.
Yeah.
Those are the